Robin and I have really been looking forward to this conversation this morning with Logan Health CEO Kevin Abel. Good morning.
Good morning, John. Good morning, Robin. Great to be here.
Thanks for joining us.
Yeah, I'm curious to know how you came to this position.
Well, let's see. Actually, it was several years ago. You all interviewed me down in the old site here. So I came in as the CEO of Whitefish after being a CEO in Washington State for 9 years, and then served there. And then the little over last 3 years, I've been over both Kalispell and Whitefish. And then the last year and a half or going on 2 years with a co-CEO with Billings Clinic and Logan Health as we've merged together there. So that's a little bit of my trajectory.
A lot of people wonder why we needed to make that change, merging with Billings Clinic. And the way it was explained to me was, it's like our business. You either get big or you get out.
Yeah, I mean, there's a lot of reasons. A lot of it was primarily clinical. We wanted to improve service throughout the whole state. So really Montana and then northern Wyoming. So right now the board wants to keep for sure within that designation. We don't want to expand beyond that. But a lot of the focus is if you think of things like the alert or the flight program. We both have flight programs. And if somebody's in the middle of the state and needs help, where's the best location and how best can we coordinate getting that person, say in Chester or what have you, to either Billings Clinic or Logan. So those types of things. There's cost things you can do with it too. There's these big supply contracts run through these organizations called group purchasing organizations. And the larger you are, the lower the cost is per XYZ product. So say take buying 50,000 box of Band-Aids versus buying 100,000 boxes of Band-Aids. You get a lower price per box of Band-Aids if you buy 100,000 of them versus 50. So there's all those types of things that played into it.
Well, the thing that we have to remember, I think, is that we consider life to be sacred.
Yes.
We don't put a price tag on life.
Yes.
Yet you are in the business of trying to pay for the ability to keep people alive.
Yeah. Well, and what we're really focused on is creating the best value. So that was part of the reason for that consolidation between Billings Clinic and us was to create the best value. So there's that economic piece. But again, a lot of it was around the clinical coordination. We're a large geographic state with a low population. So there's a lot of outreach that all the cities do. And to have better coordination there clinically was key. Along those lines are things like getting on the same electronic medical record. So we're currently working on that now. We've brought up the 4 Highline hospitals under Logan. So Shelby, Cup Bank, Conrad, and Chester. So those are all up now. We'll be bringing up the Kalispell side here soon. And having all that kind of communication with Billings and all the other critical access, the smaller hospitals across the state, if somebody needs to be transferred and getting that information electronically to the larger places is just going to be great for patients.
Well, that's a life-saving thing, too. Yeah. Just having the information you need when you need it.
Absolutely.
Yeah,
Absolutely.
And maybe they won't have to ask me what my medications are anymore.
We're working on that, Robin, for sure. That's actually one of the pieces of that project.
Yeah. But at the same time, I understand. I had somebody say, well, sometimes you remember a new one.
Yeah. Well, it's if you have a list of them, certainly you need someone to keep track of that.
That's right.
My gosh. One of the things that we're hearing a lot about in the news right now, and I just whatever you can tell us about this, the situation with Obamacare or the Affordable Care Act. It seems like while some people are going to be cut off from their insurance, this is potentially going to have a huge impact on the services you provide.
Yeah, potentially. So it was just the start of November that people are re-upping for their next year. So that's just kicked off. The shutdown is a component of that. Is our federal the federal group is trying to work that out. So it's really unknown the number that may drop off. So we've seen some articles saying, if your premiums and all that go up a certain amount, some people will choose to stay uninsured. But right now we don't know that actual number. I think another thing that occurred is around Medicaid. So Medicaid changed with the Big Beautiful Bill, so that changed. But for Montana, we're not quite as concerned as some other states because we always did have a work requirement. And that was one of the things that came up with that new legislation was a work requirement. But because Montana already had that, there was less concern here in terms of people on Medicaid.
You've been around the business a long time.
Yeah.
We keep hearing waste and fraud in the industry, and boy, I've never seen it here.
Yeah, no. I think a lot of that is some of it's around the complexity of it. I think you've heard many, many times that no one would say if we were to create a new system from scratch that we'd come up with the insurance and the billing systems that we have. So I think there's always complications around that. But no, I think in terms of running those types of things, your larger institutions do quite well. So.
It appears to me that, at least from, I'm honest, as a person with Medicare, seems that it just rolls from the patient perspective. It's pretty darn, it's smooth and easy.
Yeah, I would say Medicare of all the payers or insurers is one of the easiest to work with, or the easiest.
But
certainly.
whenever I visit my primary care physician, she spends a tremendous amount of time coding everything that I say to her.
I've been at this for over 25 years, and I would say that's probably one of the largest complaints from your line staff is the amount of time spent with documentation and that. Some of the things we're trying to work on to get around some of that bureaucracy, and some of it is set by just the way the system is we're trying to really work on, and we'll lean into AI, I believe, in the future, some better voice recognition in the future, and anything we can do from a technological standpoint to assist our physicians and nurses and providers to spend more time with the patient, because it's that one-on-one connection. And how that nurse looks at you at the bedside and talks to you and treats you the same way with physicians, the amount of time they can spend, really looking at you and talking to you about the issues versus paperwork, the better off we all are.
I need to correct myself here. This is Logan Health, Billings Clinic co-CEO Kevin Abel. All right, Kevin.
How does that work exactly? You're kind of the one over here, and then there's one on the other side with Billings?
Yeah. So Dr. Clint Seeger is my co-CEO out of Billings Clinic, and I am the co-CEO out of Kalispell here. So how we're running things is we kind of have a East and West division.
Yeah.
So Billings being our East division, Logan being our West division. We're both CEOs over those respective divisions. So for me, that is Kalispell, Whitefish, Conrad, Chester, Cut Bank, and Shelby, as well as our clinics down in Polson and up in Eureka. And in Billings, it's Billings Clinic proper and a hospital there, and then in Townsend and Stillwater, and then a lot of strong affiliations throughout the state.
Okay, and then you guys collaborate on things.
Yeah, and then what we're running is we have a system team that's kind of over all of it, and we're working as co-CEOs there. Dr. Seeger will have a little more focus on the clinical integration, and I'll have a little more focus because my background is a CPA in business on the business side. So that's how we're working things now.
So, how's that process going? Rob and I have both been in situations where we've been in mergers, and we always learn that it takes about 6 months before anything happens because you got to figure out, the playing field. How far along that project are you?
I'd say we're about midway through. I think culturally we've made some really great strides as an organization, and then there's some things that will take a little longer because you may be caught up in some long-term contracts and things like that you can't bring together immediately. For example, we have different health plans for our employees. One is run through one insurance and the other's through another. And we're going to combine those to save costs for everybody across the board, but we needed to wait until middle of a year. Now, I think Dr. Seeger and others have helped us work on some really neat clinical consolidations. One is with GYN oncological surgery. So GYN oncology, we've had a couple individuals from Billings Clinic that will come out to Kalispell now, provide that here where people don't have to leave the city. Before, patients that needed that either had to go to a place like Billings or Spokane was the nearest other place for that service. So that's a lot of what we're trying to focus on. So we'll be focusing on a few key areas like hematology and oncology will be another one.
And of course, this is the enormity of what you're trying to do. Just I don't think most of us even have a clue.
Yeah, together, it's interesting how we've grown over time. So Logan Health has about 4,500 employees, and then Billings Clinic a little over 5,000. So just under 10,000 employees that all working together and rowing in the same direction, over 1,000 physicians and advanced practice providers. And so I think one of the things we really rely on is the expertise of those staff. What you find is you'll never know as much about, say, hematology and oncology as the oncologists do. So working with that group and having them collaborate and speak brings us all together and coming up with some of the neatest, newest ideas. Robotics is another example.
The robotics is something that Logan Health has been one of the leading providers of getting into that and doing some surgeries here that would never have been thought possible in a place like Kalispell.
Oh, absolutely. It's interesting. So our journey there. So Whitefish was actually the first hospital in the state to have a Da Vinci robot, and that was well over 10 years ago. Since then, we've really expanded robotics. We got another Da Vinci robot in Kalispell. We have a few now throughout the system, but another one, that's about a $2 million piece of equipment. So you can do all sorts of GYN procedures, general surgical procedures, etc. on that. So we got another one of those this year. We also, a few years ago, added what's called a Mako robot for total joint surgery. If you told me 20 years ago we'd have robots assisting the physician on a total joint and that 50% of them would be leaving the hospital the same day they go in, I would have said that's not something that I see coming 20 years ago, but here it is. And so we have about 50% of our total joints done on that Mako robot going home the same day. And then another exciting one the board's looking at for next year is a Globus neurosurgical robot. So if you have some spine compression or the neurosurgeons are needing to work on something, a robot getting into that is something we're seriously considering. So a long journey there, and we've really been at the cutting edge of that for quite some time.
You mentioned AI earlier.
Yeah.
How does that figure into all this?
We're still learning, but it's figuring in a significant way in terms of where we think things will go. So, for example, can AI look at and consolidate some clinical information for physicians in a faster manner? It's going to be a big piece of what we're moving to with our electronic medical record. We're going to a group called Logan Health. So Oracle, which is one of the largest IT companies in the world, and is really heavy into the cloud and into AI, bought a company called Cerner, which was the second largest electronic medical record owner throughout the United States. And now that they've owned it, we're moving to that, and they're going to start adopting a lot of AI technology into their system.
Wow.
So.
One of the things that we're learning from the Mayo Clinic, for example, is they've got using AI to combine lab results, millions and millions of lab results coming in, and they think that there's a possibility that they can actually prevent disease from happening genetically.
Exactly. That's that kind of thing is exactly where we're trying to head, and to partner with people like that. One of the benefits we have with coming together with Billings Clinic is Billings Clinic has a long-standing relationship with Mayo Clinic, and so they're formally involved with them. It's something we're looking at for the future here in Kalispell as a part of that, and AI is one of our critical conversations around that. The world the world may change even more in the next 20 years than it has in the last 20 years that I was just talking about.
Well, you're sitting at the top of all of this stuff, and what's the most rewarding part of being a CEO of an organization like this?
I would say it's the people and the patients. People go into nonprofit healthcare, which is the driver throughout this country, usually for a reason. They care about people. It takes a certain kind of person to choose to be a nurse and to think about how they're going to spend their time with people and that are often, feeling bad and not at their best, and to give that kind of care. So I've always enjoyed working with those people, with physicians. They go into it to assist as well. And then the technological and the interesting care side of it that they can, talk about, and that I always am learning something new.
Looking back over the past year, what have been the main accomplishments or milestones that come to mind?
One milestone for us is this is our 50th anniversary for the Alert program.
Oh, yeah.
Yes.
So 1975, one of the first flight programs, rural flight programs in the country, oldest in the state. So we've really been celebrating that. There's, for example, if you go to the historical museum, we have in the bottom floor an exhibit there doing that. Then one of our foundation leaders, Bob Sandman, just gave a talk to about 50 people about the history there. So you can go on our website, look up Alert, and look over that history. So that's been one exciting thing.
Yeah, 50 years. John flashes back on it because it was...
Well, it was a classmate of mine, a boyhood friend of mine, that actually was the impetus for beginning the Alert program, Denny Buck.
Oh, logging.
Yeah.
Wow.
Yeah.
Wow.
So, and of course, Bob Sandman over at my alma mater, Central Junior High.
Oh, small world.
Yeah.
It really is. It
Yeah.
really is.
Yeah.
And all of this is the fact that we were able to pull this Alert program off here, where they haven't been able to even try to do it in much bigger places, is pretty amazing to me.
Now, we look at the Alert helicopter, but you have the fixed wing program, too, to bring people to the clinic or the main hospital.
Yeah.
Right?
So through Kalispell, we have 2 helicopters and then 1 fixed wing out at the airport. Fixed wing being for a lot of transports. If you need to go to something that's, we take care of the vast majority of cases here, but let's say you have a significant burn and you have to go to one of the few burn units that are out there, like fly to Seattle. So we can use that for that kind of piece. But a lot of it is for us to fly out to a rural area,
Right.
be able to land on a pretty small strip, grass strips in some cases, load up a patient that's, out in the middle of the state, and then bring them here for whether it's cardiology or trauma or what have you. So some of those types of things.
Well, the Alert program definitely is something we're all proud of.
Yeah.
As far as looking ahead to this next year, what are the main priorities?
So for Alert, one of the priorities will be for us to continue to collaborate with our Billings Clinic program in Billings. We have 2 helicopters and 1 airplane here. They have 2 airplanes and 1 helicopter, is making sure we're just coordinating that really well. So we have a single leader over both programs and integrating that, and as well as some of the transfer methodologies and communication there. So that's one with that one. I think another thing we're doing just with Billings in general is outreach. So we do a lot of outreach to different sites. One is, for example, our weekly mobile mammography unit. There's needs out there in the state with our affiliates throughout Billings and others that we can coordinate that with. And then outreach of some of the specialists. A lot of these smaller towns don't have the volumes or enough patients to have a cardiologist there 24/7. But they certainly do, and they need to have somebody out there maybe a couple times a month. And so coordinating people coming out of the city of Billings and then the Flathead Valley here to go to those areas and decide who's going where, when, and what's most efficient and what's most consistent for those patients, so they can build a relationship with their physician, whether it be a cardiologist or what have you. So those types of things are some big ones.
So in person is important, but you also have telehealth, correct?
Yeah, telehealth has made great leaps in the last several years. And so that's another one that we've brought together too. So we have a singular leader over our telehealth systems. We're still using different systems. That's what I was talking earlier. Well, you get into these multi-year contracts and have a system developed, and if you pick one versus the other, you have to kind of wait until some of that goes out. But we have a singular leader over it, and then it's some decision making to get on a similar telehealth. One of the things, Dr. Muir, one of our psychiatrists and others, if you look at the number of actual patients that they work with versus on telehealth versus what they used to do years ago, where it was all in person, it's dramatic. So he can do some clinical meetings with patients over telehealth. That before these individuals would be driving 2 hours to come in because there aren't many psychiatrists throughout the state.
But telehealth, you guys can do so much more with that than we could just a few years ago. For example, you can send vital signs to the doctor here in Kalispell.
Oh, exactly. Yeah, there's pieces of equipment you can hook up to it as well. It's not just a Zoom meeting anymore. So there's more you can do with that. I think along those lines, another one of the projects we are working on is what's called your PACS system, which is your archiving system for all the radiology exams, whether that be an MRI, a CT, mammography, etc. And we're moving on to one system for that. So it's a GE system, and coming up on that. So if somebody has an image at, say, again, in Cut Bank, anybody can read it here. Eventually we'll have them set up to do that out of Billings and things as well. Anybody can read images throughout, and that's their ability to send them, again, to places that, where that ER needs to see that and know what's going on. And so that's going to go live December 9th.
Sounds
a lot of big projects like that on this huge list.
Sounds like your bench strength is deeper now with the two organizations.
It is deeper. It is deeper. It certainly takes time, as you alluded to earlier, John, but it's deeper. It's deeper.
One thing that, from your vantage point, with all the years you've been in medicine and been doing what you're doing now, what do you think is the thing that's on the horizon that's going to make the biggest difference for patient care?
I still think that artificial intelligence is going to be a significant one. And it's out there. You don't know 100% of what it's going to do with it, but I think that's going to be a big one. I think we'll also see some growth certainly in pharmaceuticals. So I think what the pharmacies are going to be able to do and drugs over the next decade, whether it be genetics or other types of things, will be fascinating as well. So I think that's going to be interesting to see whether you're trying to look at something for type 1 or diabetics or oncology, etc. So a lot of neat things are going to happen in the next 20 years, 10 years that I think are going to fascinate us even more so. When I was talking about 20 years ago, I would never see it say you do a total joint in the same day.
Yeah. So, my gosh. This has just been a wonderful conversation. We thank you so much for taking time out of your very busy schedule to speak with us today. The co-CEO of Logan Health and Billings Clinic, Kevin Abel. Thank you so much.
Thanks, Kevin.
Thank you. Pleasure.